Good afternoon, nurses. This is Mary Turner, President of Minnesota Nurses Association, also bedside care nurse, ICU at North Memorial, and Robin are here right outside G15 in the Capitol building for the Senate Health and Human Services Omnibus bill, the people, for the public. What the nurses are trying to do here with keeping nurses at the bedside is not only are we trying to save our profession, but we are fighting for the right to professionally advocate for you at the bedside. All we want is a voice at the table so that we can take better care of you. Because I'll tell you what, our hospitals are not factories. You are human beings, and we want to be able to treat you with the care and compassion like you deserve. And so I'm going to bring up Erica Helling. She is from Fairview Southdale. And everybody cross your fingers, say a prayer that this gets through, because we need it for the people of Minnesota. Thank you.
Hi, so like Mary said, I'm Erica. I've been a nurse for 25 years at Fairview Southdale, and it is not any better than it was in 1998 when I started. It's a whole lot worse. Staffing is making us, we're breaking nurses right now, and we are here today to make a difference, to take a stand, to help get some legislation to protect us. We went through our contract negotiations. We made every effort. Even in negotiations, the employer said, get this done at the legislature. So guess what? Here we are today. We're going to get this done. This is how we protect our profession, our right to a say at how it is we protect our practice at the bedside. And you know what, Minnesotans, this is for you. If we don't have a say in how it is we do nursing, you will suffer as patients, and that is at the core of what we're doing here. If we don't protect you, our nursing practice dies, and then nurses leave this profession. So we've got lots of opportunity to build it, and that's why we're here today to defend it, and we'll have lots more to say on this as the day goes on. Thank you. I'll give this to Tricia from Children.
Hi, my name is Tricia Rishkis. I'm a night nurse at Children's in Minneapolis. We as union nurses fight day and night for safe staffing. We fight for our patients and families, our coworkers, and our profession. Working short staff puts patients at risk, creates moral injury and burnout. We have said over and over again that there is no shortage of nurses, only a shortage of nurses willing to do more with less. Our working conditions are our patients' healing conditions. Just as educators' working conditions are our children's learning conditions, our patients and our communities deserve better. Nurses are and we know what they deserve. Our experience as healthcare workers is vital when it comes to decision making on safe staffing levels in our units. The staffing provisions from the Keeping Nurses at the Bedside Act would create committees where we can our needs of our patients in order to create safe action to protect nurses and patients, to keep nurses at the bedside. Despite corporate interest groups that might say that the nurse licensure compact would help solve this nursing staffing crisis, we are against it. It will lower standards for nurses in Minnesota, harm patient care, and undermine our collective bargaining rights, and risks sending Minnesota's surplus of nurses to other states facing real nurse shortages. We need to stop listening to corporate interests that are against what we need as nurses and our patients need. That is why I am here with my fellow nurses to support the Keeping Nurses at the Bedside Act. Thank you.
Good afternoon. My name is Jean Foreman. I am a retired registered nurse. I left my career in 2021 due to, in no small part, the staffing that was becoming a daily problem on my unit. We would have morning safety huddles with the announcement from a manager that we are 5 nurses short, 6 nurses short, or what have you, and the solution was do the best you can. If you were due to be getting off your shift or maybe starting your shift, you would undoubtedly be getting text messages from the staffing office, come in early, stay late, come on your day off. This is a crisis that is so ongoing that it wore at my mental health, and I made the decision to retire from a career and a job that I love. I'm doing okay now, and I want to make sure that I continue to advocate for Minnesotans so that you know that we have got your back, and we are doing everything we can humanly possible to fight for you and get you the care you deserve when you are admitted or getting care at a hospital here in Minnesota, whether it's a unionized hospital or non-unionized hospital. We fight for you, and we're going to continue to do it until we get what we need to take the very best care of you. Thanks.
This is Mary Turner again, and I just want to clarify for people, there are plenty of RNs, registered nurses, in the state of Minnesota, over 122,000. There are plenty. We've done a workforce study recently of 2,400 nurses. 80% of those nurses said they left because of short staffing. 80% of them said that they would come back. They would come back to the bedside if staffing improved. So I just want to be very clear. We have enough nurses. What they can't tolerate is the working conditions right now to stay at the bedside. Thank you.